and ladies and gentlemen. I know that you are a mixed audience, so I have tried to keep my presentation as broad as possible. Before I go into the presentation, I would like to greet you all on the occasion of this new year from the National Institute of Traditional Medicine, which is located in Belagavi. So, what is traditional knowledge? So, traditional knowledge, it encompasses the know-how, the skills, the innovations and practices which are developed, sustained and passed down through generations within a community. It is often very integral to the community's cultural and spiritual identity. It also includes areas such as the traditional technologies, their ecological knowledge, their knowledge of medicines, their cultural expressions in stories, in rituals, songs, very broad. Typically, they are transmitted orally from generation to generation, and it is adapted to the local culture, to the local needs, to the changing environment, reflecting a deep understanding of the surrounding world. Therefore, today what I am trying to deal with is obvious that this knowledge and practices of these medicinal plants involve an intersection of history, culture, science, community, everything together. And what we are trying to do in our institute is to bridge the gap between this ancient wisdom with the present day healthcare, and we just act as a conduit to bring the best of both worlds together. The historical perspective, we know that the knowledge of medicine is ages old, and the use of medicinal plants has been the mainstay of most of the medicinal usage, and it is as old as the humanity itself. Even archaeological evidences also support that the medicinal plants were used in prehistoric times. Ancient texts like our own Charaka Samhita, Sushruta Samhita in India, the traditional Chinese medicine, Materia Medica in China, the Egyptian documents, they all say the same thing. This use of medicinal plants for health has been there since a very, very long time ago. I have tried to put a clock of the world traditional medicine systems, starting from Ayurveda as one of the oldest systems of medicine, followed by Chinese traditional medicine, Egyptian medicine, Babylonian medicine, Greco-Roman, Siddha, Unani, Kampo, the Japanese medicine. Then thereafter homeopathy and all came. So, a few of them are left out because I wanted to make it a clock with only 12. So, I have taken the top 12 which are practiced. So, essentially what I want to say is that the Indian systems of medicine actually comes in the oldest forms of medicine, and the plant materials had been the mainstay of that. Now, I come from the Ministry of Health, Department of Health Research, Government of India, and we work very closely with the Ministry of Ayush because they are the people who actually are working on Ayurveda, Siddha, Unani and the other indigenous systems of medicine. But then there are differences between Ayush and the traditional medicine. So, that is what I have tried to depict here. When we talk about traditional medicine, we generally tell they are codified system or non-codified system. The Ayush system, as we know, are a subset of the entire traditional system of medicine. So, the recognized systems are the Ayurveda, Siddha, Unani, Yoga, Naturopathy, Siddha, Swarikpa, homeopathy. But then other than that, there are a lot of other practices that are there in the society. Particularly we call them as folklore medicine, sometimes the tribal medicines, because they are often practiced in tribal communities, in tribal herds. Even the kind of dadima ke nuske that we generally have in our homes, mostly handed down by generation to generation from our grandmothers to mothers and then later on. So, these are all kind of systems which come under the non-codified system. Now, sometimes the practice of these non-codified systems are often regarded illegal, because they do not have a legal sanctity. But in one of the research that we did some 15 years back, we found that we did this study in the Western Ghat region, and we found about 50% of the traditional practices that happen might be doubtful, but around 50% of them which are there, which appear to have some substance in the manner in which they treat, the substances that they use, and there has been some improvement in the people who have taken treatment from. And that has formed the basis of subsequent research, because where you find something appears to be working, so that is taken into structured, scientific, rigorous testing, and then you come up with the results. You may prove it, you may not prove it, but that is how things come out. And that is one of the activities that our institute does. So, we are basically people from modern medicine, I will come to it, but looking at this wealth of knowledge that exists around us, which sometimes we keep a blind eye on, but that need to be documented, that need to be researched, and the best of them to be translated into practice. So, ethnomedicine and indigenous knowledge, what is that? The role of indigenous communities. So, these indigenous knowledge systems are rich repositories of plant based medicine, often transmitted orally through generations. There is the problem. I said in the very beginning, these are mostly oral transmissions, there is no written down manuscripts and all for the non-codified systems. So, what happens is that over time, the knowledge gets lost, and what is happening today with the electronic age and media and all, we have traditional medicine practitioners who come to us and tell us, sir, please take this knowledge, because our children are no more interested in pursuing it. So, after me the knowledge will die. So, please take whatever we have, whatever you test, you do your test and all, but preserve that knowledge. So, this is what we generally see in the field. So, these are areas where we need to document these practices for this generation and even for posterity to do research and then find these practices whether they are useful or not. There are several examples, all of us know about these examples, which we use day in and day out in our daily routine, in our daily foods, in our daily diets. There are ethnobotanical studies where research has documented plants with therapeutic properties, and many of them, such as the haldi, the curcuma longa, known for its anti-inflammatory properties and many other properties including anti-cancer activities, antiseptic activities. Ashwagandha, we just had a discussion in the previous lecture itself, and it is extremely well valued adaptogen. So, these are all various knowledge that has been documented by the TKDL. It was launched mostly to protect the usage and the rights of the Indian systems across the world. So, it was one of the major activities undertaken by the CSIR, the TKDL. We at ICMR-NITM also did a study again around 15 years back, and we have documented more than 500 plants that are used in this non-codified systems of medicine across the Western Ghats in 5 states, Karnataka, Maharashtra, Goa, Kerala and Tamil Nadu. And for various diseases and disorders, and earlier we had actually published it in the form of a CD, which was a priced edition, but since 2017 it is available as a free resource. You can just type NITM medplantsdb.in in your browser and you can actually access that website, and every detail about these plants which are used in traditional medicine in Karnataka, in Western Ghats are available there, including the references of the studies that have been done on them. We also have a directory of the practitioners of non-codified systems in the Western Ghats. So, there are about 120 odd such entries that we have, and what we find is that some of them are so called specialists. Somebody will be specializing in, say, in fractures, somebody in renal stones, somebody in kidney stones, somebody for arthritis, so somebody for gastrointestinal disorders. So, these are kind of practices that we have documented, but this we have not put in public domain, because as I said, many of them are illegal practitioners in terms of law, but once research is needed, so we can direct people, we can say that this person does on this, and also if you want to do some research, you can very well approach them and take it for further research for the sake of knowledge generation and for documentation purposes. Similarly, there are such resources outside the country as well. This is for the Brazilian medicinal plants. There are others for the Chinese traditional medicines as well. So, it is not only in India, these kind of things are being done across the world. So, the pharmacological and therapeutic applications in drug discovery, that is what we had this discussion in the morning. So, my job is very easy. I will try to skip some of these slides. Sir has already said, Dr. Dinesh, how the large number of modern medicines are actually derived from medicinal plants and they are engineered. So, many of the drugs that you see today perhaps would have its origin actually in natural products, and then they have undergone some development, some changes in functional moieties and the chemistry, and then they have come as drugs. Similarly, there is the other approach of reverse pharmacology, which serves to validate the use of medicinal plants with modern technology and techniques, and that is exactly what our institute does. Say we find a particular treatment is working very well for a particular disease, and we take that disease and that treatment pair, and then we try to see if this drug works for that particular disease, what kind of disease. I will tell you a very simple example is, say, for hepatitis. Now, when a traditional practitioner practices some or gives some medication, some plant based material for hepatitis, he will not say it is for hepatitis, he will say treatment for jaundice. So, it is left to us to understand what kind of jaundice it is, whether it is obstructive jaundice or biochemical jaundice, what kind of jaundice, whether it is a viral jaundice, infective jaundice, hepatitis B, C, what kind of jaundice it is. So, once we identify that, then we design studies in the laboratory, in vitro assays, in vivo studies, in animal studies, and then we try to find out whether how effective is this particular treatment in what dose for this. A safety study is a must for everything, which goes without saying. That is the first thing that needs to be done. And we also have some principles while we take up research in medicinal plants. Say, for example, we don't work on those plants which are in the RET category, because even if we find some activity, we may not be actually able to translate them into proper usage, because we will land up in perhaps exploiting that species and it will be gayab altogether. So, these are some of the things that we need to consider as scientists, then only we take up that. So, once we establish that yes, it is safe and it is efficacious, then we try to find out the molecular mechanisms of action. So, that is called the reverse pharmacology approach, so which our institute follows. So, the drug discovery, as I said, I will skip this slide because we had lengthy discussion previously. So, this has provided new structures, new templates, new scaffold for drug discovery, and again structural diversity and all. So, I will not go into these details. Interestingly, they say less than 10% of the world's biodiversity has actually been screened for their biological activity. So, therefore, there is a lot of scope for all of you to actually concentrate on this kind of screenings for this biodiversity of the medicinal plants for various kinds of uses. So, I told about this concept of reverse pharmacology that we use. So, it is basically going the opposite direction, something which we find useful. Even this reverse pharmacology can be for the Ayush drugs as well. So, certain things which we very often use, but then we perhaps do not know the mechanism of action, we perhaps do not know the dosage that is used for. Some of the treatments that we have in Ayurveda are not like generic what we use in modern medicines. They are given based on the prakriti of the person. So, if you try to correlate with the prakriti and then with a different prakriti, a different drug. So, these are all components of research that can be dovetailed to the existing drugs which are actually being used. So, what we do is that we have two components, one the community component and the laboratory component. In the community, we start with a situation analysis where we have experts in community medicine, we have social scientists with us, we have MD in pharmacology with us. So, what they do is that they do the documentation, observational studies on what is being done by a practitioner in the field, in the community, in the tribal belts, and then what is the plant that they use and what purpose it is being used for, and what is the perception of the patients who are taking, then follow up of those patients whether they are getting benefited or not. And then when we find yes, this seems to be working in this category of patients for this particular disease, then we bring them into the lab, then we do the complete pharmacognosy, the ethnomedicine of it, the correct identification of the plant, which is extremely important, because if we make a wrong identification in the very first place, we are gone. So, it is very critical in taking up any research. Then composition of it, the genuinity, vouchering, the physicochemical parameters, biochemical parameters, biological properties we do. We do a complete chemoprofiling and chemical analysis of the extractions that we did. We have found different chemotypes in the same region, same season, but between different plants, even if they are taxonomically the same. So, these are things which needs to be recorded, because today if I do a research with botanical and tomorrow somebody else does it and then there is a difference in the activity, then we will just blame each other कि नहीं ये बोलेगा कि ये इसमें activity था, वो बोलेगा नहीं था. So, that might be because of the variations in their chemoprofiles. So, those are things which needs to be done. As I said, toxicity studies are done mostly for safety and dose, and then we do a very lengthy bioinformatics as well, because that actually helps us guide in designing the in vitro assays. What are the likely compounds that are present in those formulations or the extracts, and then what are the likely targets of the disease that it is actually working on. So, that helps us design the in vitro studies where we do the molecular biology, the biotechnology, if any. As sir said, sometimes we need to increase the production of certain secondary metabolites. So, those are being done in the lab, and then we generally sometimes some plants do not grow well in nature. So, we need to grow them in tissue culture. So, that time for the production itself it becomes better. And then preclinical efficacy in animals, and then once the animal studies is done, we actually take it to the field and do the clinical validation of this for mostly the RCTs or some comparative studies we do in the communities as well, or in the hospital settings. So, that completes the validation cycle of a particular medicine and disease pair. Now, it is not necessarily that we always identify our own leads and then complete it. There are possible that many of the things we know certain areas, but certain areas are gaps. And that is where we require all of us to work together, see that the entire cycle is completed. So, wherever there are gaps, you will find a lot of them which have actually come up to the preclinical studies, but the clinical studies have not been done. Somewhere some clinical studies are there, but the mechanism of action, the molecular biology of it is not done. The bioinformatics often is not done. So, these are kind of areas where, depending on the expertise that we all have, we can chip in and actually contribute to the validation cycle of the traditional medicines that we have from plants. This is an example of one of those that we did the complete cycle is on arthritis. So, it was a treatment which they called for joint pain. So, we identified it was for osteoarthritis, not rheumatoid arthritis, and we actually went up to the clinical trial where we actually did with 120 subjects, and it was a topical application on the knee. And what we found, it was a paste of Chitraka, and what we found is that once this is applied for 7 days, the cytokine markers and the OMAC score and the tenderness and all, they sustain for about a month. So, if you apply it 7 days and then you can skip for another month and then again apply. So, that will reduce your unnecessary dependence on the NSAIDs, which have their own side effects, as well as it will give you a long lasting thing. But this one we are done with the extract. Now, this also has got plumbagine. So, plumbagine, many of you will know, is a little toxic. So, although there is some shodhana which is being done, but still there are some people who have got some allergic reactions to it. So, what we are trying to do is, now we have developed a gel, and a clinical trial, a multicentric clinical trial is ongoing with the gel. So, if the gel is found to be even better, then we can suggest the use of this particular gel as well. Similarly, we had done a study on this Lakshmi Taru, Cimaroba glauca, and what we found is that actually it enhances the anti-cancer activity of paclitaxel once it is added with that as a drug. So, again it is a combination of a modern medicine and a traditional system to help in the effectiveness, but it remained in that stage. We did not do a clinical trial, and again we cannot do everything together. So, this is also on hold for some time, but this is something which can be taken forward. It was published. Another study is there which is on the essential oil from Surangi, Mamia suriga. So, this was found to be extremely good for treating diabetic wounds. And again we have completed up to the preclinical studies in animals, and clinical trial, multicentric trial is ongoing with this study. So, we expect to get results by next year. Integrative medicine is where we are moving towards, and now our institute is focusing mostly on integrative medicine. This is an interesting area where actually the government is viewing to have indigenous systems of medicine working in tandem with the existing modern medicine, if you may so call, but in a synergistic and cohesive manner. In the Viksit Bharat 2047 goals, it is actually planned to integrate some of these very well established traditional medicinal practices into the healthcare. Say for example, I am having some kind of disorder, some disease which I am taking a modern medicine for, but that is causing extremely high GI irritability. I take something from the traditional medicine side to take care of the GI irritability. So, that becomes a integrative health approach. So, that is the kind of things that we are looking at, and as you can see, there is a lot of overlap that happens between the conventional medicine, the complementary or alternative medicine, if you may call them, and self-care. So, there is a kind of overlap. So, this overlap areas are where this integrative health works. carry pill is one of the example. You may be knowing for dengue, many people are nowadays, even modern medicine people are actually prescribing carry pill. So, a lot of studies have been done on carry pill, and it has been found that it increases the platelet count. One thing is for sure, it does not cause any harm. So, it is not toxic. So, there is no harm in trying that. So, whenever somebody gets dengue and all, use of carry pill is likely to keep the platelet levels to a manageable level. May not be always, but there are studies that it has been found to be effective in actually improving the platelet count. In one of the study that we did, so this is on breast cancers, mostly soft tissue cancers. Now, this doxorubicin is a very widely used anti-cancer chemotherapy drug. Now, problem is that it is limited because of its use with the dose, because it is extremely toxic to the heart, liver and kidney. Now, what we did is that we used animals, both induced with soft tissue cancer as well as the normal rats, and we found that if both are given together, the doxorubicin plus cocoa extracts, we find that the adverse event on the heart, liver and kidney is much reduced. So, but then again, this is the dark chocolate only without any additives. So, that is a disclaimer. We had got a number of papers published on this, but we have not done a clinical trial yet, because there are much problems in designing the clinical trial with this kind of studies, particularly with the number of patients that we need to do. But then, since this is already a food substance, addition of this cocoa, the unsweetened and unadulterated cocoa, could be a strategy to actually manage these toxicities that are caused by the cancer chemotherapy. This is the study that I said going on the topical application for the arthritis. This is the study which is going on the Mamia suriga for diabetic wounds. This is another study which is evaluating the genetic and protein targets through a Ayurvedic formulation for the tau mediated tauopathy. This is a study which we are doing in collaboration with TDU. So, it is adding of the methi chips containing methi for management of anemia. So, one of the biggest problems with the iron folic acid is the gastric disorders, and people do not want to take it, and also we are trying with methi chips. The study is ongoing, but methi chips also, it is a little bit of the methi kadwaness is a little bit too high. We are trying to reduce it and see what best can be done, but this is one study which is ongoing. Again, it is in integrative health. Another study which is ongoing in Pune is on the Triphala for sustaining the weight loss, mostly the central obesity. Most of the medications that are used, once they are stopped, then again the obesity comes back. So, now there is a hypothesis that the Triphala can actually have the sustained weight loss. So, that clinical trial is also underway. There is another study which this is a drug from the Ministry of Ayush. So, the Ministry of Ayush had given us to do a clinical trial on this particular drug for management of fatty liver disease. So, we just completed the study with 100 participants, and we are blinded, so we do not know the results. So, we have just communicated the results to the Ministry of Ayush. So, once they are analyzed, we will be knowing the results of it. So, the challenges and opportunities that are with us, first is the preservation of knowledge. I was telling you that because of the lack of interest in the present generation, so the knowledge is actually dying, and we need to document this knowledge. And for scientific validation, yes, bridging these traditional practices with evidence based research is crucial. You will find any plant always showing some activity or the other if you go to any papers. How much trust do you have in those papers? How much trust do you have in those studies? Unless the methodology is very robust, unless they are published in very well thoroughly reviewed scientific journals, people will always have doubt. Therefore, quality of research in traditional systems is extremely important. And some of the disservice we do to our own system is by publishing in these Raddi predatory journals. So, we have to take a collective step and see that whatever research that we do it very sincerely, and we publish in proper recognized peer reviewed journals, so that the message goes to the people. Even if it is a negative finding, it should be published, but it should be done with a proper methodology and proper well known publications. So, we need to collaborate between ethnobotanists, chemists, clinicians and all. I showed in my team, we have people from all disciplines. I am also nobody in this vast knowledge. A lot of things to be done, but it cannot be done single handedly. It has to be done everybody together for our own benefit. Sustainability and conservation, one of the very key factors, because we are losing on our natural product resources. What happens is that most of these Ayurveda pharmacies and all, what you will find, they will give contracts to suppliers to give them the crude drugs. Now, where they will come from? My botanist friend says that what they normally do is that they will give a contract to one taxonomist to identify and GPS map the locations where these plants are located, including in reserve forests, and then they will give contract to another person to just plug them, and then they will bring, and then they will do the extraction and give to these people. That is not the way we envisage traditional systems of medicine to be taken forward. We need to preserve, we need to conserve these resources. These are all gold mine for us. Sir was telling, I was shocked the amount of money that he talked about, 1 kilo of oil. So, these are kind of natural resources that we have, and they have to be preserved, and we need to develop some kind of a ecosystem going in which the farmers can cultivate them. We will have much more uniformity in their chemo profiles, as well as they can be used for commercial and sustainable utilization. So, the future direction is, it starts with us, with research and development, whatever we are able to contribute in our own way by collaboration and leveraging the knowledge of metabolomics, the genomics, the engineering, the AI, everything together, establishing an integrative health research network that we are trying to do and disseminate this knowledge. Then comes the next level of educating others and creating awareness among all the stakeholders, all the public. And then we need at the highest level the policy support for formulating guidelines for intellectual property rights that we were discussing in the morning itself, to sharing and respect and reward of the indigenous contributions, strengthening collaborations and taking them forward. With this, I would like to end my presentation with abstract of the what I call as the evolution of medicine. It's a 6 abstract story. The first abstract tells you the use of the constellations, the stars and the moons for our health. Then came material sciences, the Ayurveda, the Chinese traditional medicine, as I showed, where mostly the botanicals and all, they started to be used for health. Then came technology, both for diagnosis and for treatment. You have a ECG curve here. And then came the personalized medication systems, your linkage to your Aadhars, your personal IDs and your social security numbers and all this. And then the 5th slide is one of my favorite, which speaks about the transition from the Mendelian genetics of small, round, wrinkled and smooth to the ATGC, and then from ATGC to 0101 computer code. And then finally we have the AI coming in with So, thank you very much.